Well, hello everyone. Welcome to Understanding Your Blood Pressure. My name is Nicole McWhorter. I'm one of the nurses from Mount Carmel, and just here with you today for 45 minutes or so to talk about blood pressure. So the first thing that we're going to do is I'm going to share my screen, and we're just going to get started with a little video that I think sets a good tone. It's a TED Talk, so don't be intimidated that it's or don't think it's childlike because it's animated. It's actually a great little intro to blood pressure. And if we're having any trouble with sound, which I had a little bit earlier, I turned on the captions so you can get a good idea of what it's talking about, and then we're going to go into it in a lot more detail.
If you lined up all the blood vessels in your body, they'd be 95,000 kilometers long. And every day, they carry the equivalent of over 7,500 liters of blood. So that's actually the same 4 or 5 liters recycled over and over, delivering oxygen and precious nutrients like glucose and amino acids to the body's tissues. All that blood exerts a force on the muscular walls of the blood vessels. That force is called blood pressure, and it rises and falls with the phases of the heartbeat. It's highest during systole, when the heart contracts to force blood through the arteries. This is your systolic blood pressure. When the heart is at rest between beats, blood pressure falls to its lowest value, the diastolic pressure. A typical healthy individual produces a systolic pressure between 90 and 120 millimeters of mercury, and diastolic pressure between 60 and 80. Taken together, a normal reading is a bit less than 120/80. The blood traverses the
Okay, so pretty remarkable, right? Our blood vessels would be about 95,000 kilometers long, or more than 59,000 miles long. That's just remarkable that that's all wound up inside of our bodies. In case you can't tell, I was an open heart nurse for a long time, and everything about the heart and the vascular system just gets me pretty excited. In addition to that remarkable length, we only have about 4 to 5 liters of blood in our body normally, but it gets recycled and pumped to more than 7,500 liters of blood every day. Just the heart is just really, really remarkable. On average, hearts beat about 70 times a minute. And of course, everyone, some people are slower, some people are faster. But for the average person, if you live about an average lifespan, it's up to an impressive 2.5 billion or so beats over your lifetime. So, an impressive muscle, impressive system. So, I guess it goes without saying that it is just truly of the greatest importance to keep our hearts healthy. And right along with it, we have to do all we can to keep our blood vessels healthy, help them remain clean and clear as possible, as well as very flexible. And we do this by keeping the blood and its contents healthy and clean with the best amount of nutrients, glucose, and the least amount of cholesterol possible. So let's take a look at blood pressure truly. So systole. Systole or systolic comes from the Greek word that means a drawing together or a contraction. So we have these two phases of the heart, contraction cycles of the heart. On the left is the diastolic, on the right is the systolic. So systole, the drawing together or contraction, you can see in that picture where it really pulls in, the muscle pulls in. So systole is the phase of the heartbeat, our top number, when our heart muscle contracts and pumps blood from the right and left bottom chambers called the ventricles. And the right side pushes it to our lungs where it gets oxygenated, and the left side pushes it through the aorta to every single artery in our body, bringing oxygen and nutrients to the body. So disregard the arrows in this image. I apologize. We should be pointing to the left side now, where we're going to focus on diastole. So the resting and filling time for our hearts, that is diastole. And in the dictionary, good old-fashioned Merriam-Webster, That means a rhythmic recurrent expansion. So the left picture, expansion. It's important that our hearts have a moment to relax because just like any other muscle, when it relaxes, it opens and makes space for blood to flow in and to fill those chambers. The chambers need to be full so they're ready to maximally squeeze out or contract and move that blood to the rest of our body. Because really, our hearts are just fancy pumps. And just like with all good pumps, you have to have lots of volume, in this case, blood, that has filled those chambers completely. So when it's time to squeeze, there's enough in there to pump out when it squeezes. One other note about diastole, that bottom number of our blood pressure, it's an extremely important time for our heart itself because we have something called coronary arteries, which are the arteries that feed the muscle of our heart. And during diastole, during that resting phase, that's when those coronary arteries actually get filled with blood and they feed our heart muscle oxygen and nutrients. Those are those arteries that we all hear about when we hear that people had heart caths or open heart surgeries. So we know they are extremely important. Okay, excuse me. High blood pressure, the silently killer, lovingly referred to as the silent killer. Tremendous number of Americans were and will continue to unknowingly live with this disease. It terrorizes their body and they oftentimes have no idea. It's called the silent killer because oftentimes there are no symptoms. And despite its role in significantly increasing the risk for heart disease and stroke, it can also have wide-reaching detriment through our body. All of that going on, and we may not even know it. The good news, though, it doesn't normally happen overnight. So there are often things we can do to know first, and then to slow and prevent this from happening. Okay, so we're going to spend a little bit of time on this slide. And if anybody jumps in and they have any questions, please just take yourself off of mute and just interrupt, please. Okay, so primary causes of hypertension. So did you know that half of the adults in the US have high blood pressure? That's a pretty striking statistic, I feel. And almost no one gets a free pass. And if we left our bodies and most importantly, our lifestyles to their own devices, the predictions are that 90% of adults would expect to develop high blood pressure sometime in their lifetime. And it's primarily because of our lifestyle. So let's acknowledge the importance of regular or at least intermittent blood pressure checks before there's any diagnosis. The best case is having your blood pressure checked at very important things like your biometric screenings, at your primary care provider, checkups each year, and then also at random times in the grocery store when you have those, you see those monitors sitting, or when someone offers to check your blood pressure. A friend, anytime someone gets a blood pressure cuff, you know, they're always very excited to check everyone's blood pressure. Any of those times. And then if you happen to be on medicine, it is imperative that you are checking your blood pressure on a regular basis using a consistent method. And we're going to talk more about that later. The other thing I want to make sure that I note is white coat syndrome, also called white coat hypertension. For those folks who only have high blood pressure in a doctor's office, a stressful situation, and even we might say maybe at biometric screenings where we ask people to fast and we're in your work environments, right? Those are all screenings, they're moments in time. And so one blood pressure does not diagnose a blood pressure, it's really a check-in. And so it goes back to our point before about the importance of having regular checks of your blood pressure. When we do check our blood pressure, it's really important to be sitting in a chair, to have a minute to relax, have your arm on a table when they are checking the blood pressure, feet on the floor and your back supported. All of those things, oh, and your legs not crossed, of course. All of those things can have a very significant, impact on your blood pressure. So don't be someone who is chatting and drinking their coffee and, runs in at the very last second with their bladder full and then is surprised when they have a high blood pressure. Make sure you do those things to give yourself the best chance of having a really good and accurate reading. Okay, so causes and hypertension. So there's primary or essential hypertension and then secondary hypertension. So now we're going to talk a little bit more about primary, sorry, and don't be those guys. So we're going to talk a little bit here about primary hypertension. So in most cases, the cause of primary hypertension is unknown. It generally increases slowly over many years. So that's where this whole silent killer comes in, because it just sort of sneaks up slow and keeps going up over and over time. Sometimes what we hear from people is, I never had high blood pressure before, but each time I go to the doctor, it just seems to be going up a little more and a little more. Those are usually examples of what we hear with primary hypertension. Although the cause can't be identified, let me say this: there are many risk factors that increase the risk of developing primary hypertension. So the first one, there's nothing we can do about. It's genetics, right? The first couple. So age, as we get older, our risk of hypertension goes up, right? Family history, especially if it is your mother or father, your risk of developing hypertension goes up. And then ethnicity. So if you're a Black American, if you're of African or Caribbean descent, definitely have a higher risk of developing hypertension. Risk, though, not guaranteed, right? And then now that cultures are blending, we're seeing an increased rise of hypertension in the Asian and Latino communities as well. So those are all things that we can't do anything about, but we need to know so that we are monitoring our blood pressure, having someone monitor our blood pressure more often. The other stuff, though, the lifestyles are controllable risk factors. And so we're going to go through these a little bit, and then we're going to go through stuff more in depth as we talk about what we can do to help manage our blood pressure. So stress, right? Constant states of stress where we are internalizing stress. We have our bodies in this fight or flight. We increase all these level of hormones, especially cortisol, epinephrine, and norepinephrine. And their jobs are to have us in this fight or flight, traditionally to protect us, right? But when we are consistently in that, we make our blood pressure go up all the time. We actually cause sugar to stay in our blood longer too. We make our heart work harder. It's a higher heart rate. It just really all compounds to make this really increased workload and stress on our entire cardiovascular system. Diets high in sodium, a lack of exercise, being overweight. The more you weigh, the more blood your body has to pump around because of this increased resistance. It puts more strain on the blood vessels, increases your risk of hypertension. And losing weight is really just really very helpful. Small amounts, but we're going to talk about that more. Smoking, can't say this enough, but I'm going to say it a couple times today. Smoking and any use of any nicotine products. Nicotine causes all your blood vessels to constrict, including those that feed your heart, your brain, and every single other blood vessel in your body. Quitting smoking is one of the best things you can do to lower your blood pressure. Okay, the same thing with drinking alcohol. Alcohol increases blood levels of renin. We're going to talk about that a little bit more, but renin not only causes your blood vessels to constrict, but it also decreases how much fluid the body eliminates as urinary retention, and causes more volume that your heart has to work against. So avoiding and limiting alcohol. And just one thing that I wanted to note is to make sure we talk about today, and I think I talk about it again later, is when we're looking at alcohol, avoiding or limiting alcohol. Something to keep in mind is, what is a serving of alcohol? And it may surprise you. 1.5 ounces of liquor, 5 ounces of wine, 12 ounces of beer. And the recommendation is for women, 1 drink per day at most, and for men, 2 drinks per day. Okay, secondary hypertension. So what is it? When a direct cause for high blood pressure can be identified, the condition is described as something called secondary hypertension. So we're just going to touch on these because they really are a lot less of the common reasons people have high blood pressure. So kidney disease ranks the highest. Renal artery stenosis, which is restricted blood flow to our kidneys. They're just cranky little organs, and they strongly impact our blood pressure, and they get very mad because blood vessel constriction restricts how much blood they get, and they really count on that. And when they see that, they do something that's very counterproductive. They actually make your blood pressure go up because they want more flow, and it turns into a very bad cycle. A couple of tumors or abnormalities that can cause the adrenal glands to secrete hormones that increase our blood pressure. Um, One is primary, and then another cause is primary aldosteronism. One that surprises a lot of people is obstructive sleep apnea. That's getting to be very, very common now, but the lack of oxygen, hypoxemia is what it's called, but the lack of oxygen from having obstructive sleep apnea causes this inflammation in your whole system and then oxidative stress. Your body responds to that by squeezing down on those arteries, which increases your blood pressure and increases the workload of your heart and your whole cardiovascular system. A couple of medicines. Oh, no, sorry. Pregnancy. Wonderful. Pregnancy is wonderful, but it is just remarkable the things that happen in a woman's body. Did you know that the amount of blood that a woman's body pumps increases by as much as 45% during pregnancy? That is remarkable. Growing a human is a lot of work, right? So it has to be monitored. And you hear people talking about that, right? You hear women talking about that they watch their blood pressure very closely. A medicine that can have a big impact on blood pressure is birth control pills, specifically those containing estrogen. And then some other very common drugs, acetaminophen, which is your Tylenol, right? Alcohol, always because of the renin that we just talked about. Let me see, I think I have a picture here. A couple of really common medicines, especially as we are now into the fall and into some very difficult seasons. I don't know if any of you are allergy people, but these medicines, you have to be really careful if you are someone who has elevated blood pressure, because some of the ingredients in the medicines can actually cause your blood pressure to go up significantly. So make sure you're just taking a good look, keeping an eye. And if you have high blood pressure, choosing medicines that have that HBP, which means it has different ingredients that won't impact your blood pressure. So now we're going to go back to our video here for just a minute and just learn just a little bit about what happens what are the different things that can impact our blood pressure.
Landscape of the body through the pipes of the circulatory system. In any plumbing system, several things can increase the force of the walls of the pipes. The properties of the fluid, extra fluid, or narrower pipes. So if the blood thickens, a higher pressure is needed to push it, so the heart will pump harder. A high salt diet will lead to a similar result. The salt promotes water retention, and the extra fluid increases the blood volume and blood pressure. And stress, like the fight or flight response, releases hormones like epinephrine and norepinephrine that constrict key vessels, increasing the resistance to flow and raising the pressure upstream. Blood vessels can usually handle these fluctuations easily. Elastic fibers embedded in their walls make them resilient. But if your blood pressure regularly rises above about 140/90, what we call hypertension, and stays there, it can cause serious problems. That's because the extra strain on the arterial wall can produce small tears. When the injured tissue swells up, substances that respond to the inflammation, like white blood cells, collect around the tears. Fat and cholesterol floating in the blood latch on too, eventually building up to form a plaque that stiffens and thickens the inner arterial wall. This condition is called atherosclerosis, and it can have dangerous consequences. If the plaque ruptures, a blood clot forms on top of the tear, clogging the.
Hello, we're so sorry. We had the wrong Zoom link and we are all just now getting it now because we were not getting the right one.
Hi, Adam. How are you?
I'm good. How are you?
Good. Well, I wasn't.
Did you hear what I said?
No, I didn't. I'm sorry.
Okay, so everyone may just start popping in now. Everyone was given the wrong Zoom link. We didn't have the correct one. So I've just sent it out to everyone now.
Oh dear. Okay. So
they all are joining now.
So do you think it is best to go back and start over?
I think if whatever you can fit in the next 36 minutes is what they will have time for. So
Okay.
it is up to you what you want to do. But we only have until 12:30.
Okay.
And I'm not going to have anyone reschedule just because this was what we've planned for. So we're just going to go with it. And whatever you can get in is great.
Okay. So I think we're just going to keep going. So we
Perfect.
actually hit just a perfect part in that we are talking. We were just doing a little introduction onto changes in blood pressure and things we can do. So I feel like of all the stuff, this is the best. Right. Should I give everybody a minute just to jump on? Sorry for the confusion.
You can just go ahead and start. And whenever they start hopping in, that's fine.
Okay, great. All right. All right. Well, welcome everyone. Sorry for the confusion. If anyone, I'm going to use my PowerPoint as the main screen. So if anyone has questions, please just take yourself off of mute and interrupt me and just like, hey, Nicole, I got a question. Okay. All right. So let's jump back to this. Okay. So we just saw a little video of from a TED Talk that was a really nice introduction to the processes that can occur when there are changes in content. Hello?
What time tomorrow?
Hi there. If you don't have any questions, could you mute yourself, please? Thank you. Great. Welcome, everyone. Okay, so in that video, they talked a lot about damage to blood vessel walls. And one thing that I just want to mention, since we are all sort of coming in at different points, is that when our blood pressure changes, we can cause stress or strain
Scott.
blood vessel walls.
Awesome. Thank you, sir.
Hi, Scott. Do you think you could put yourself, here we go, we're gonna. Okay. So the blood vessel walls can actually have these little tears, small tears, where glucose and cholesterol and all the things that float around in our blood can actually adhere. And when they adhere, they cause almost like a little bubble. And so unfortunately then, everything that flows by there that has any sticky properties will then continue to adhere to those. It's like a little party. And that's where we can get atherosclerosis, but we can also get clots. So both dangers of anywhere in any of our vasculature when we have elevated blood pressure. That was kind of the stuff that we just talked about then. Excuse me. So this is a little bit hard to see, but one of the things I just wanted to cover, potential complications of high blood pressure. So damage caused by high blood pressure starts small and builds over time. But what you get from this picture is you see there is no part of our body that is safe when we have high blood pressure. So we know the big stuff we know is like heart attacks. Everybody kind of knows that, right? Those small tears, again, where the stuff can build up and cause either plaque or atherosclerosis that can then go to our heart or to our brain. Everybody knows about heart attacks and strokes. Some of the stuff that I want to talk a little bit about is the other stuff that's just as important, but doesn't get as much press, right? So whenever our blood vessels constrict, our heart has to work harder against those blood vessels in order to get oxygen and nutrients from our nose to our toes, everywhere in between, right? And it becomes, instead of becoming like a bicep that gets big and strong, it actually gets bigger and weaker and floppier. And that leads to something called heart failure. And the heart can't keep up. As it gets weaker, the blood pressure tends to change to try to compensate that. So it turns into this very ugly cycle that goes along with heart failure. And it can simply be from having uncontrolled high blood pressure. We hear so much about stroke. So I think we'll skip on that. Oh, but one thing to remember is, in addition to the risk of stroke, if you have elevated blood pressure, not for a minute, but for a long time, this is one of those that tends to grab people's attention. We now know that it can play a role in developing dementia and cognitive decline over time, causes memory and thinking problems. It's becoming more and more clear. I think some of the stuff we've normalized, like heart attacks and strokes, but this one tends to get people's attention, right? They're like, wait a second, I've had someone I love who died of or suffered from. I don't want that, right? Kidney disease and failure, and we talked a little bit about this, but our arteries that feed our kidneys, first of all, our kidneys are very crabby little organs, but the arteries that feed them, if they become constricted from having elevated blood pressure, when our arteries get smaller, then it tells our kidneys, hey, listen, we're not getting enough blood flow. We need to raise our blood pressure. And the way that we raise our blood pressure is we constrict our arteries. So you can see how that turns into a very vicious cycle. Again, nose to toe, or I should say hair tips to toes, but vision loss can come from elevated blood pressure over a long time. Anywhere that we've got blood vessels, right? If they're constricted, we can lose whatever function comes from the being fed. This is another one that tends to get attention from people. Sexual dysfunction, high blood pressure. Your sex organs use lots of blood flow during arousal. And if those arteries have reduced flow, it can lead to erectile dysfunction in men, lower libido in women. The list sort of goes on and on, okay? And then, of course, the term peripheral artery disease, I'm not sure if any of you are familiar, but peripheral artery disease means any artery in our blood, in our body, that has a reduced diameter in the tube or has buildup in that tube, peripheral artery disease. And so that just means that it has reduced the risk of reduced flow to anything that those arteries would feed. Another one that surprises people is osteoporosis. High blood pressure can actually lead to increasing bone loss, especially, you already have that for women and men as our body gets older, and it can increase significantly if we have high blood pressure. The same thing for our respiratory system. And then the other one, sleep apnea. Sleep apnea, when people need CPAP masks, which are becoming, or sleep masks, or they have all kinds of different names. But the loss of oxygen in our blood from sleep apnea, called hypoxemia, causes inflammation and oxidative stress through our entire body. So it leads to damaging of the blood vessels, but in addition, it tells the inside of the cells, hey, listen, we've got to squeeze down and cause our blood pressure to go up more because we need more of the oxygen. So you can see, once again, it's another one of these very detrimental cycles. Once it starts, it's really hard to get out of. Everybody doing okay? All right, so when you have been at your biometric screenings over the last, 5 years or so, you've learned that in 2017, the American Heart Association and the College of Cardiology came together and they said, we have a problem in this country. Blood pressure is absolutely out of control. They said, we've got to do a couple of things. First thing, we've got to redefine what high blood pressure is. And we have to look at each of the numbers independently, because we know if one is high, it impacts one side. If the other one's high, it impacts the other side. So we have to pay attention to both sides and change this so that we want our systolic goal, which is our top number, to be less than 120, and our diastolic goal to be less than 80. So some people are like, oh my gosh, my doctor says that that's really restrictive, and that's not true. Unless you are someone who has chronic hypertension, or if you're like 75 years old or have had blood pressure your whole life, the chronic hypertension, these are the standards for what we should want to achieve for optimal health. So please keep that in mind and remember that you might have to advocate for yourself a little bit. So you can see, and I'm not going to read these to you, but I just want to point out. So on the left, or on the middle category in systolic, we want for normal to be less than 120. We start paying attention, 120 over 29, we go, okay, this is a little bit elevated. We're going to call this just elevated, but we're not really ready to call it hypertensive yet. When we get into the 130s, high blood pressure, hypertension stage 1, then we've got stage 2, and then we've got hypertensive crisis. The hypertensive crisis has a number, but that is truly based on if someone has symptoms as well. On the diastole, on this side, you'll see that the bottom number, the diastolic pressure, there's no wiggle room. You're either less than 80 or you're not. Okay, there's no elevated for that one. And the reason is during diastole, that's the resting phase of our heart. And not only does heart need to fill. But in addition, that is the time when the heart fills the coronary arteries, which are the vessels that feed our heart. So there's no wiggle room. If the pressure's too high, we're not going to feed our heart as efficiently, and it's not going to fill as well, and it's going to proliferate a whole cycle of hypertension and ineffective squeezing. So calling hypertension what it was, the 120 and the 80, was a really, really big change. And getting buy-in from providers, honestly, has been one of the biggest obstacles. So just understand that these truly are the accepted standards. And sometimes you might have to say to someone, hey, listen, I've learned this, and I really feel like I want to do things to try to get to this goal because it's best for my health. There are naysayers who say that this all was prompted by big pharma to get people on medicines and get their money. And please know that this is not the goal. The goal truly is when we change these standards and we get providers to start identifying these dangers in people's health, the goal is that they start talking to their patients and educating them about lifestyle changes that they can make to manage their blood pressure. And that's what we're going to talk about next. So you are fighting for your life with lifestyle management, but just know you are in control and you have the power. I am just amazed at our ability to accept and incorporate and normalize high blood pressure as part of our health picture. I'm here to tell you today, you don't have to do. And I don't know about any of you, but after the last couple of years, I am very ready to be in control of absolutely anything in my life. So this next slide here talks about got high blood pressure, and it was put together by the nutritionaction.com. One of my colleagues is a dietitian, and she provides these wonderful guides. And when I saw this, I just felt like this is the key. This is the key. Everybody's got something that they want to sell you in order to help fix your health and fix your blood pressure. I'm not a fan. I am a big fan of moderation and just trying to make small changes that have a big impact. And so on the left, you'll see it says, and we're going to go into this stuff a little more on the next slides, but it says DASH. What is this? A DASH diet, but no, it's not a diet. It is a lifestyle, it is a dietary approach to trying to eat healthy in moderation. And so DASH stands for Dietary Approach to Stop Hypertension. And what the focus truly is: more fruits and vegetables, less bad fats, less sugary stuff, and foods that have a lot of high salt. And then they go through, and then on the left, you'll see over here, there are recommendations, and I think this is really interesting, of what a serving actually is, because that's something as Americans we just don't pay a lot of attention to. And their servings are based on a very realistic calorie diet, 2,100 calories. That's something else that we have to be really careful of, these very, very restrictive diets. So below, it talks a little bit about exercise, and we're going to go on to this, impact of weight loss. And on the right, some ways to reduce sodium and limiting alcohol. And then in the middle is something that doesn't get a lot of press. It's not quite as sexy: how to get more potassium in your diet. So there's no time like the present to quit nicotine. This is the first one, and you can read this slides to yourself, but it is truly the most important lifestyle change you can make to improve your health and your blood pressure. 20 minutes after quitting, your heart rate and your blood pressure will drop closer to normal. That's remarkable. Can you imagine the impact of quitting completely? Right? Nicotine harms the inside of our blood vessels. It causes constriction to the blood vessels, and it reduces the amount of oxygen that our heart receives. It all causes our heart to beat faster, damaged blood vessels to work harder, turns into that big ugly cycle again. So limiting or eliminating alcohol. So we already talked about what a serving is, right? So small, right? But some contributing factors for primary hypertension: alcohol releases blood levels of renin. It's a hormone, and renin causes our blood vessels to constrict, which means they get smaller. It also says, hey body, we got to hang on to fluid. So it eliminates how much we urinate. Well, when we reduce how much fluid we're letting go, it's got to go somewhere. So it actually goes into our blood vessels and increases our blood volume, causes more strain on the blood vessels from the inside. So it's constricting those blood vessels, all while increasing our blood volume. And it just really turns into more of this, same story I've been saying about each thing, increased workload for our whole cardiovascular system. The good news is it can be temporary as long as it's not a chronic problem. So the effect can wear off once you stop drinking and your liver has time to process the alcohol out of your body. If it is excessive, chronic, then it becomes a lot longer and a lot more difficult for your body to recover. In addition, just something to keep in mind, alcohol is high in calories and oftentimes high in sugar, increases the risk of high blood pressure by adding body fat, and also increases the amount of sticky stuff floating through our blood, glucose, lipids, especially the triglycerides that are all floating around and cause damage to the arteries. Any questions? Everybody doing okay? All right. The combination of increasing potassium with things like fruits and vegetables, and then less sodium, less sugar, and high saturated fat. That is the heart of the dietary approach to stop hypertension. And you hear this in a lot of other things. One of the other really common lifestyles of eating is Mediterranean, and it's very similar. So you can see on the original slide, if you go back to it, but you can see the fruits of, and it just goes into fruits and vegetables, low fat dairy, good grains, legumes, lean meats. It's all the stuff that we've been talking about for a long time, eating real food, right? The one that seems like people are a little less familiar with is how to get more potassium. So the more potassium, this is from heart.org, the more potassium we eat, the more sodium you actually lose through your urine. And then the water actually follows. So sodium reduces our fluid retention. And potassium also helps ease the tension in our blood vessels. So if they're constricted, it helps them loosen, helps them open up a little bit, helps lower your blood pressure. So in that slide before, where it showed got high blood pressure, it goes through and it talks about potassium in places that people don't really realize. Like we all know green, everything, evergreen, if it's green, eat it, right? But baked potatoes, tuna, sweet potatoes, spinach, bananas, milk, cantaloupe, oranges, romaine lettuce, the list just kind of goes on and on. So lots of easy sources to get more potassium in your diet. So keep your curves healthy by watching your weight and your waist. So when Mount Carmel comes and we do your biometric screenings, we look at your weight, but we also look at your waist measurements. And we talk to you about the importance of having a healthy waist measurement. This is not from crash dieting or starving or dehydrating yourself, but some of these impacts that are listed, losing every 2 pounds you lose can lead to a 1-point drop in systolic pressure. I know that doesn't sound like a lot, but if you are someone who's kind of hanging at 125 for your systolic pressure, where you're like, oh, just a little bit elevated, but I really want to get in that 120, losing these pounds can help you. 10 pounds reduces your waistline and really can bring down that blood pressure. When we bring down that blood pressure, we are actually reducing the strain on our heart and reducing our risk of developing hypertension. And so just keep an eye on that waist measurement too. Right? Everybody kind of knows now. We've been coming there for a lot of years. And remember to measure it at your belly button. That's where your real waist is. Managing stress. It's not going away, so keep it at bay. So I know everyone says there's not enough time, there's no chance, stress is everywhere. Absolutely, stress is everywhere. And so a lot of what we talk about is how to not internalize stress, right? Because we can't often make the stress go away. Most of us cannot buy an island and go live at peace on an island, and we wouldn't. It would be too lonely, I think. I don't know what you guys think. But anyhow, back to this. So avoid trying to do too much. And remember this, if everything is a priority, then nothing really is a priority. So figuring out each day, really, what are your priorities? Learning to say no to some things, and then trying to allow enough time to not only get things done, but to care well for yourself. Knowing how to hear your body, to listen to your body and respect when your body is telling you, I've reached a point where this stress is not okay, where I am internalizing this stress, and then trying to find some ways to allow yourself to relax. Everybody has different ways that they relax. Some like to take a walk, some like to exercise, some like to sit and read a book, some like to just truly sit and do nothing. And that's all okay. But making time each day to give a little self-care where you do whatever it is to release and relax. And then practicing gratitude. There is absolute definitive research that shows when we practice gratitude, we reduce our stress and improve our health. All right. Okay, exercise. I know it can be such a, oh gosh, it can be loaded with a lot of feelings for people. So we're just going to call it movement, right? Because movement matters. Anything that gets your heart rate up, it makes a difference. So park far away, take the steps, walk with intention, have a dance party, chasing your toddlers, chasing your teenagers, whatever it is, where you can each day moving your body. And you see these, it says, the recommendations for moderate intensity versus vigorous intensity, and then muscle strengthening, right? So moderate intensity, anything that gets your heart rate up. Okay, so all those things that we just mentioned, brisk walking, water aerobics, dancing, gardening, tennis in doubles, right? Biking, we should probably add a lot of other fun exercises in there, but anything that you can do it, but you can talk and the person knows, because they can hear you breathing a little bit heavier, but you can still hold a conversation. That's moderate intensity exercise, right? Versus vigorous intensity. It's a lot harder to hold a conversation. So things like hiking uphill with a heavy backpack, high intensity interval training, running, swimming laps. That sounds like a bad idea to try to talk, right? Aerobic dancing, really heavy yard work, right? Cycling, jumping rope, singles tennis, the list kind of goes on. But the best way to determine if it's moderate versus vigorous is, can I hold a conversation? Okay. And then the muscle strengthening, please know that doesn't mean you have to join a gym and start pumping weight. Because if you do all that, that's great. But if you're someone who uses things like yoga or stretching or Pilates or anything with your own body weight, but where you're actually strengthening your muscles, that counts. So movement matters. And then this goes on to show there's a tremendous difference that moving your body can make. Some of the big wins, and I'm not going to read all these to you, are short-term and long-term. So lowering our risk of heart disease, stroke, type 2 diabetes, high blood pressure, dementia and Alzheimer's, a whole lot of types of cancers, and some complications during pregnancy. Those are some of our long-term, right? Did you know that with a single bout of moderate to vigorous physical activity, immediate benefits to your health, improves sleep, reduces anxiety, reduces blood pressure. And then the long-term benefits to our brain, cognition, improved memory, attention and processing speed, right? Reduces symptoms of depression and anxiety, improved quality of life and overall well-being, all of the heart health, cancer prevention, healthy weight, helping us maintain a weight, or if we need to lose a little bit, helping us come closer to achieving a healthy weight, improving our bone health, balance, and coordination. Those all go hand in hand. So not only do we improve our bone health, we improve our balance, and then if we do fall, our bones tend to be stronger. So hopefully double win, right? Because maybe we reduce our risk of actually breaking something. And then there's lots of research that is showing that physical activity, especially consistent physical activity, boost our immune system. So know your numbers. We do not have to accept hypertension as an inevitability. Please know what's normal for your body. Have your blood pressure checked in multiple different settings. Come to your biometric screenings, right? We are very friendly, but also follow up with your provider. And then if you're on medicine, please, oh please, oh please, have a blood pressure monitor that works well. check your blood pressure at home and make sure that that medicine is working, not just once a year when you go see your doctor. If they tell you to keep an eye on it, you should be monitoring it and recording it, and you want to be using the same monitor. You want to be, and for anyone who's getting their blood pressure checked, what we don't want to be is like this lady in this picture here. So make sure you guys can see this. She's got her legs crossed, her back is not supported. She just finished drinking coffee, I'm guessing. She's chatting, her arm is supported by the provider, but there are so many things here that are just wrong. So don't be this gal, right? And just remember, this is your health. You now know what the standards are. You understand what the standards are. You've been hearing it. Don't be afraid to advocate for yourself and to say to your provider, like, I really want to achieve the best blood pressure I can. What do I need to do? What do I need to do to be the best and healthiest? Then just last screen here. This is startling facts from the World Health Organization. And please keep in mind, this was before COVID. I think it's so important that we say that because we became very sedentary during COVID, and it's persisting. But you can read the first ones, the ones that I wanted to share. And again, this is a worldwide problem. Globally, 1 in 4 adults do not meet the global recommendation levels of physical activity. So that's a lot. 5 million deaths a year could be averted if the global population was more active, just by being more active. People who are insufficiently active have a 20 to 30% increased risk of death compared to people who are active. And then the last one is heartbreaking. More than 80% of the world's adolescent population is insufficiently physically active. That one just really gets me because kiddos, I don't know, they should be out playing. They should be active. They should have every opportunity. So I'm going to stop sharing. I'm going to come back here. So does anybody, let's see. So I do see a question here in the chat. So blood pressure varies. How much of the variance is the person taking my blood pressure? How much is the commute into the blood center? Oh, great question. Okay, so just want to address this one in the chat here real quick. So there's of course going to be a little bit of variance, unfortunately, depending on how good the person is who's checking your blood pressure. But now you've got some control over some of the factors that can impact your blood pressure. So just make sure if you're driving there like I would probably drive there a little bit late, maybe just try to give yourself a couple extra minutes. And if you can't, then stand at the door and just kind of give yourself a minute. And then make sure when you sit down in that chair that you sit, your feet are on the floor, your back is supported by the chair. You exhale for a minute, and then your arm is actually up on a table when they check your blood pressure. Try not to chat with them, kind of go to your little happy place and see if that makes any kind of a difference. One blood pressure does not make a high blood pressure. And when I look at your numbers, I see like a lot of ballpark, right? The 130 over 80, the 120 over 80, the ones that have a diastolic of 80 make me go, what's going on? Were you hydrated? Were you feeling stressed? So a lot of questions that I would ask, but I like your top number, of the 110s and the 108s. So consider maybe those factors, and then also go to the bathroom before you go in. That can have a big impact on your top number. So let's see. Yes, and then your blood pressure cuff impacts it as well. Good point, thank you. And can you email us with the chart for the DASH diet? Couldn't read it. Yeah, I'd be happy to. So Autumn, if maybe you could, do you want me to send it to you, Autumn, and then you could distribute it? Would that be the easiest method?
Yeah, that is perfect. I can send it out to everyone once you send it to me. Perfect.
Okay, anything else that I could include, anything that would be helpful? Okay, does anyone have any questions about anything? All right, well, sorry again for the confusion, and I'm really glad you guys joined me for the last part. Oh, yes, go ahead.
Triglycerides, do you basically lower them the same way as lowering your cholesterol and stuff like that?
Yeah, I mean, a lot of the stuff is real similar, but triglycerides are much more specific to two things. So the way that you use your carbohydrates, and then also you'll see a change in those with weight loss and weight gain, oftentimes from carbohydrates. So carbohydrates are breads, rice, pastas, and sweets, right? And so switching to having like whole grains to have some good carbs, because everybody should have carbs, right? We just want to make sure we're having good carbs. And then, the other big one that can impact your triglycerides is alcohol. So if you are an alcohol drinker, a little less often. Same things with the breads, rice, pastas, sweets. It's a little less often will help with your triglycerides. The only part that I'll say though that we don't have any control is if there is a component of genetics, right? Some people have a genetic link for any of the different factors of cholesterol. So that one's a little bit of a gotcha, but it's much less common than our lifestyle factors.
Thank you.
Sure. Any other questions about that? Okay. Anybody else have anything? All right.
My
oh.
only other, I was the one that did it through the chat directly to you. So when I donate platelets, I want to be hydrated the day before, but the day of, I really can't be. I have to stop drinking several hours before. Otherwise, there's a problem when I'm in the chair for 3 hours.
Gotcha. Okay.
So I will try the tip about going to the restroom before. I will try to get there a little bit earlier, so I'm not worried about the commute. Any other tips?
The hydrating the day before is imperative up until the minutes that your bladder will allow. And especially the 24 hours before is really going to have the biggest and best impact for you.
All right, thank you.
Sure. Good question. And thank you for donating. Okay. All right. Well, thank you everyone for joining. We did record this today. So if you want to see the first half, feel free to snag it after probably the end of this week, beginning of next. It'll be up on the portal. And if anyone has any questions, feel free just to shoot them to Autumn and she can reach out to me and I'll be happy to address them separately. All right. Thanks so much, everyone. Take care.
Thank you.
Thank you.